Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, super excited about this episode. My guest is Tiffany Flaten. Tiffany Flaten is a thyroid expert in nutrition. As a founder of Rock Bottom Wellness, Tiffany helps thyroid patients improve their symptoms through proper nutrition education. She's helped hundreds of women and men get to the root cause, find a way up from rock bottom, be their own best advocate, and shortcut the path to an amazing life. Today we'll be discussing her first book and her personal experience as a thyroid cancer survivor. I hope you enjoy the show. Hello everyone, super excited to be here once again. I have my friend Tiffany Flaten. Tiffany, how are you doing?
I'm doing well. How are you?
Doing pretty good. I was called into the office on a Monday, which is weird. I usually have Mondays off. So we had to reschedule, and then we had to reschedule, and now we're here.
That's awesome. I'm super excited to be here.
So for anyone that's listened to this show before, I like to start my interviews with, Tiffany, what's your hero story? How did you go from being someone with some thyroid problems into someone that is an advocate in helping people with thyroid disease?
Yeah, well, how long do you have? Because that story is a long story. No, I just had this story where, it's so many people's story where they get knocked down and they work their way up, and then they use that as a platform to help others so they can avoid doing the same thing. And that was absolutely how that happened with my thyroid story. And I believe it goes back to probably even high school. I can even probably go back to that time frame, but for sure college, my symptoms started with severe depression, but was, left untreated for quite a long time. And then once I got treated, one of the doctors that I saw prescribed Synthroid, and I didn't have a thyroid problem because my numbers were normal. And lo and behold, my depression symptoms started to subside. So that was kind of the key where I knew I had some underlying thyroid stuff happening, but it was just never diagnosed until I was diagnosed with thyroid cancer. So I never was diagnosed hypothyroid, Hashimoto's, nothing until thyroid cancer. And then that's the real struggle started. And from going through that process, the easy cancer, going through that process, made me learn how to help myself because I wasn't getting help from, the traditional methods of dealing with thyroid and thyroid cancer. So I had to do it on my own, essentially. And that's where I started really working with people. In fact, I quit my other day job and I started to do what I do now, creating a business to help people get out of the hole of the thyroid symptoms that they're dealing with. So that's my story.
If our listeners haven't figured out, we're going to be talking about one of my favorite subjects and something that I do day in, day out at Integrative Health. And, I have an excellent mentor. I had Dr. Alan Christensen is my mentor.
Oh, awesome.
Yeah, he is the thyroid guy. So all of the stuff that, we're doing at my clinic, it's not only evidence-based, but also with compassion, which is so important. And that's something that we're lacking in this area. So you mentioned depression. What are other symptoms that you might have some thyroid problems?
There's, I think, 1,001 symptoms. For me specifically, I believe that depression showed up first in full force, and then anxiety, and then skin issues, then muscle fatigue, then debilitating, just overall general fatigue. Also the hair falling out and that kind of thing. That was another symptom, which is very common. So I'm probably at this point 24, 26 years old, and I'm being told that I'm just getting older. I should quit worrying so much, all these things. And I'm thinking, I am in my 20s and this is it. I have peaked in how life is supposed to be, because I just had no interest in doing anything because I just felt horrible all the time. I know a lot of people deal with digestive symptoms, and that wasn't really something that was an issue for me. So a lot of the, telltale signs that we know now, I didn't really have. I had more of that fatigue piece. That was probably the most frustrating and irritating thing. And getting sick all the time. I was sick all the time with not just the sniffles or something like that. It would be chronic sinus where, we put on medications over and over and over again. Nothing helped. Bronchitis, pneumonia, meningitis. I just felt like I thought I must have some immune deficiency of some kind, and
which you did.
which I did. But of course, those were normal too. Those were all normal because, of course, I had to look into that because I know enough to, I knew enough to be dangerous back then with my education background and stuff. But nothing ever showed. And again, I just kept on being told, this is just life. It's just you're stressed. You've got. And I'm like, I have a busy life like everybody else in my age group and probably everybody else in every age group. Why is this so debilitating for me? So that's where it came to a head with the cancer diagnosis.
I got two questions for you. What was the motivation for your first doctor to give you a little bit of the synthetic thyroid? Did you ever question him or ask them, like, hey, my numbers fall within the range. How come, you're prescribing me this? And then the second, why were you within the range? How come your numbers were normal?
Mm-hmm. So he was a psychiatrist and he had prescribed, I think I might have been taking, probably like a Prozac or something like that at the time. And he said has found that a lot of his depression patients with depression that were taking an SSRI benefited with a low dose Synthroid. And it was actual Synthroid. And he said he's seen improvement with a low dose. I don't remember what my dose was. I don't know if it was 25 or 50. I don't know what it was. He just said, I don't care that your numbers are in the normal range. It has helped. Let's try it. And it did for a while, And then I got pregnant with my first child, and my obstetrician she was not about taking medications. Like I could barely take allergy meds or anything. She didn't want any of that stuff, so I went off everything. And then the answer to your second question about why was I in the normal range despite the symptoms, I don't know for sure, but I think it's narrowed a little bit, but I feel like the normal range for normal thyroid or TSH is really broad.
And the way that we arrived to these reference ranges is that they were testing people in general. So they would be like, hey, let's test you. Do you have any thyroid problems? And people would say no. So then you would be included into these numbers. There's a newer study out of Turkey where they actually did two things. They tested the TSH levels and they also did ultrasounds, thyroid ultrasounds. And if there was any changes in the cytology or the cell structure of the thyroid, they would be taken off this reference range. And what we found out is that the optimal ranges for thyroid are going to be somewhere between 0.5 and 1.5. When you kind of zoom into that optimal range, you see all causes of mortality drop, not just thyroid. That's why in functional medicine or in our practice, we try to optimize levels. And just think about it this way, okay? Your thyroid is making this little tiny hormone, tiny little hormone that affects every cell in your body. Now, let me say that again, every cell in your body. And if you were to extrapolate the numbers for thyroid and how how it affects your whole metabolism, it would be like getting an Olympic-sized pool and you putting 5 milliliters of a liquid inside that pool. So that's about one spit, like if you spat. So now, like imagine, how tiny that dose and how it dilutes to the size of an Olympic pool. And that's just the perfect ratio of blood to thyroid hormone. That's why thyroid hormone medication is so tightly regulated within the body, because it is just so important to have the right ratios. Now imagine you have all of these symptoms they overlap with a lot of things. So, for example, anemia could have all of the same symptoms. And then you have this tiny little low dose Synthroid that maybe bumps up from 2 milliliters of spit to 3 milliliters of. Now you're going to have a little bit more well-being, but there's more. You can do more.
Right.
Yeah.
Much more to
more.
optimize everything.
To optimize everything, yes. So we're talking not only about looking at a paper, meaning your lab work, and then optimizing, we're looking at the person and then looking at the science and then optimizing everything for that patient.
Yeah, and it's interesting because just prior to starting this, we talked a little bit about taking my child to the doctor today. And for various reasons, I asked if we could run a thyroid panel. She just said no. And I said, can we at least do, T4 and T3? And she said no. So that was a little disheartening, but it just kind of goes to show that there's so much misinformation about what we can get from those numbers.
And I have a theory about why the T3 and T4 are usually denied, is that if you are taking thyroid medication, they really don't tell you much. Let's think about, the pool and 5 milliliters of liquid, okay? Your body is so tightly regulated in so many ways, okay? So, for example, let's talk about something like insulin, okay? Insulin and diabetes. So if you have insulin, it goes into your bloodstream and it pushes sugar into the cell. If you have too much insulin and too much sugar and you continue pushing the sugar into the cell has to do something with it, and it eventually starts killing the cells because there's so much reactive oxygen species and you're creating so much damage to the cell that the cell goes, you know what? I'm going to stop accepting this insulin and I'm just going to become insulin resistant. So then, you become type 2 diabetic. Well, if you continue accepting T3 or T4 into the cell, and remember, the T3 and T4 affect every cell in the body. It can upregulate the nucleus of that cell and it can burn up that cell. So at some point, your body has all these different mechanisms to bail out the T4 and T3. So you pee some of it, you poop some of it, you sweat some of it, you utilize some of it. And even if you're taking a dose, the first thing that shifts is going to be your TSH, your thermometer. And your body will be able to kind of get rid and bail out some of the T3, T4. So that's like a late indicator of what needs to be controlled. So yeah, I cannot make a decision on how much thyroid medication I'm going to prescribe based on free T3 and free T4. But it can give us other insights into what the body is doing. Can you talk a little bit about that?
Well, I look at it from the nutrient perspective as a nutritionist. I look at what are their nutrient statuses in order to allow conversion of T4 to T3, and how is their liver functioning to help that conversion of T4 to T3. And to your point about the thyroid hormone affects every single cell in the body, and I knew that before I had my thyroid taken out from the cancer. I knew that before, but it really hit home when I went back to my job as a high school anatomy and physiology teacher. We started the endocrine system, and the first sentence about thyroid was, the thyroid gland affects every cell in the body. Exactly what you just said. And so I was like, oh boy.
Not even insulin. Insulin, like the brain has receptors that don't need insulin for sugar to go in. And this is important because, the brain is so important, and glucose for the brain is so important that you don't need insulin for glucose to go into the brain. Okay. The thyroid affects every single cell in the body.
Right. So that's when I knew that when I wasn't feeling that great and I was getting ready for treatments and that kind of thing, that this might be a difficult process. And it had turned out to be not your standard textbook. I was not a textbook case of dealing with thyroid cancer, apparently. So that's when I started looking into, okay, what do I need to do? And that's the first thing I asked my doctor was, if I don't have a thyroid gland anymore, and I'm taking just T4, how am I converting that little pill to go to every cell in the body? How do I know that I'm converting properly? And that's where it kind of started. And to be honest, he didn't really answer me. He just said, it just does. It just does. I guess I was stubborn enough to just, keep looking and searching and what can I do to help optimize that process. And for me, I had a lot of food sensitivities and, started with that and just started to optimize everything. I guess I keep using that word optimize. I just needed to go through, a process, methodical process of figuring things out, cleaning up my system. And so that I could support that process. And also, another doctor that I had started to see allowed me to try a trial of Cytomel. The T3 is alongside it. And that was a game changer for me. That got me out of the hole of hitting rock bottom. That got me out of the hole. And then I could keep improving, and the motivation kept working. I kept getting better just over time. It was years, over time. So I'm trying to shortcut that for people, so they don't have to do all the digging and research and doctoring and all that stuff.
Have you tried any natural desiccated thyroid?
I have. I tried Armor because I was told by numerous people, practitioners and just people who were dealing with and taking medication, that it would change my life. It did, but I kind of slid backwards. I went backwards with it. And I don't know if it was because my doctor didn't hesitate to allow me to try it. That's when awesome. I wanted to switch it. He's very good at listening to my symptoms and listening to me. And he allows me to have input in my care. But we tried it, and I don't know if I know that's not his main medication that he prescribes for thyroid. I mean, he told me that. So I don't know because I know it has to be dosed a lot differently than your standard Synthroid Cytomel. So I don't know if that was a problem, but my symptoms got way worse. I back to way at the beginning of the process. So I'm a little hesitant to try that again, to be honest.
You didn't fail that medication. That medication failed you. I would say 93% of my patients are in some form of natural desiccated thyroid, with 5% of my patients being on a combination of Cytomel or Tirosint or levothyroxine, and then the rest of the percentage, would be taking 2%, would be just taking levothyroxine. They're doing fine,
Mm-hmm.
So it really depends on the patient, Now, there's a lot of arguments of why a natural desiccated thyroid could be better for you. It has T2, it has thyroglobulin, it has, all of these different things. And then there's better forms of natural desiccated thyroid than Armor, things like WP thyroid, which is completely additive free. But yeah, it really depends on the patient, and having someone that knows how to dose it properly and how to check properly. So when you make that change, you don't go 6 months without rechecking, which happens often, So you had normal TSH levels, I'm assuming, since that was the only thing they were checking.
They were 2.5, 2.8, something like that. So yes, normal, but not optimal.
And you had cancer.
Yeah. And even at the diagnosis, my TSH was probably 2.5.
Yeah. What the fuck?
Mm-hmm.
It's it's incredible. And then how was the cancer diagnosed? And I think this is very important. So perk your ears if you're listening.
Yes, it's so important because I went to my annual physical with my PA, who I would go to every fall. It was always September-ish timeframe because it's getting back into the teaching game every fall, high school, like I said, anatomy, physiology, biology, high school students. And I had to go on anxiety medications every fall, and went to see her for that and do everything else. And she just did palpate my neck, and she goes, "Oh, there's a little lump there. Have you ever noticed that?" And I said no, but I always had, the hoarse kind of scratchy throat for a while, but I have allergies. So I always was like, well, it's just that. A few years prior to that, I actually did have a lump in my throat. I could feel it constantly in there. I can't remember what it was called. and it, went away. And they said it was, of course, stress related. So then she just said, well, we should probably have an ultrasound done, but 98% of them are benign anyway. So no big deal. And I was like, okay. I left there knowing, like, I just knew that it was cancer. I just knew, even though 98% of them are benign. And so did the ultrasound in a kind of a local area. And then it came back normal, or they said it was fine, but she wanted me to go see an endocrinologist, and I couldn't get into him for weeks or months or something like that. And I had a connection with someone to get me into the Mayo Clinic. They said, we'll get you into Mayo Clinic with the head of endocrinology. And I got in there in a week, and I brought my ultrasound with me, and they said, that's okay. We do our own here, because they do just thyroid ultrasounds all day long. And they did their ultrasound. The radiologist came away and did several passes with FNA, and it came.
What's an FNA? And then and describe the process, because it sounds horrible, but this is something super important. As a clinician, I've encouraged a lot of patients to go get a fine needle aspiration, but I've never had one done. So can you describe what happens?
I will describe it. I've had several. So it's not horrible. I mean, you're laying on the table where you're doing the ultrasound. Radiologist looks at the preliminary reports, and then he goes, okay, we need to check this out. So they come in and they numbed it. I believe it must have been like lidocaine or some, I don't remember exactly what it was. But of course, I watched it on the ultrasound that, the needle's going in. But he took, I believe at the time, the first one was 6 passes of a fine needle. And they basically just, put it into the suspicious area and, suck out the fluid that they can get from it and then send it to pathology.
Yeah, so it's a way of going in and getting some cells from the suspicious nodule that they can send to a pathologist to see, hey, is this the type of cell that reproduces really fast and is invasive? Or is this just a solid nodule that it's calcified and it's not dangerous?
Yeah, and there was, I think, 6 passes because it had spread to the lymph nodes. My cancer had spread to the lymph nodes and up the jugular chain. And so they took, stuff right from the thyroid. And that was, I don't remember now, but I feel like it was a pretty large nodule on the right side of my thyroid. And then up the jugular chain, there were several. And so they went a few of those spots. And so, it got to be a little bit long of a process. It's really not that big of a deal. I guess my experience of it wasn't that big of a deal. I've had others since then that weren't quite as easy, but I don't know if it's just because of what they were trying to, get into, if something was more calcified, or I don't know, it was just more of a struggle or whatever. And then I got the answer. That was a Friday. I got the results back Monday that it was absolutely cancer that had metastasized to the lymph nodes. And so my surgery, standard operating procedure, is to remove the whole thyroid. And then, of course, the lymph nodes, that they as many as they could. And when they did pathology after that, there was, can't remember for sure. I think there was maybe 8 that were malignant of the lymph nodes.
Wow.
And then a year later, I had a recurrence with more lymph nodes in the same kind of area. So they just kind of added on to that scar, but then treatments in between and scanning between. But, all that it's not fun. None of that is fun. And surgery and hospital and treatment, that's not fun. But it was not, that was easier than figuring out how to feel like a normal person afterwards. And I didn't even know what normal was. I just knew that I probably hadn't felt normal since at least high school. And so I wanted to get back to that, and I didn't even know what it was. It just I couldn't be where I was. I could not live like I was living.
What options were you offered for your thyroid cancer?
Options, did you say?
I have a true story, okay? And I wrote a little bit about this. I had a patient who had a 2.x thyroid TSH, and she was gaining weight. She was feeling bad. She goes to one of those big clinics, and they just don't have any answers. So your numbers look right. Now, we screen every single one of our patients with an ultrasound, okay? Because I don't have ultrasound hands. I wish I did. And I could feel a nodule. And I said, we're gonna screen you. We screen every single one of our patients gets a thyroid ultrasound. And sure enough, she had a nodule, and she had a cancerous nodule. She had gone to that big hospital, and they called her, hey, you have cancer. We need to do a surgery tomorrow. And she was like, you guys didn't catch this. My naturopath caught this. And then she said, I am going to go visit him first because you guys have been my doctors for over 10 years and you never had this idea. So she shows up the next day, and she had brought in a family member, and that family member was like on the corner, and she was like uncomfortable, and I think, when my patient asked me, what should I do? And I said, well, obviously surgery. The family member let a sigh of relief because she thought, oh, this dude is going to try to do some magic on her and we're gonna lose her. And no, surgery is it's not easy and no one wants it, but sometimes it is necessary. And in her case, it was. But again, they wanted to put her under the knife probably within 16 hours of her diagnosis. And that is scary.
That's a little reactive. I think you need to kind of look at all other things. And mine was probably 2 weeks after my diagnosis. And the thing is I kind of say options like that was a bad thing, and I don't really think it was, because I don't think there would have been other options. I mean, for what it was in there and how it looked in the lymph node, involvement and being it slow growing, I'm guessing, I've had that growing for 10, 12 years. If he would have said, you can wait till next year or 6 months from now, there's no way I would have waited. I wouldn't have. When you hear that diagnosis, even though, like I say in air quotes, it's the easy cancer. I mean, I was told that so many times. And at the time I felt a lot of relief in that. But then afterwards I was like, are you kidding me? There's nothing easy. There's nothing easy about this. I know that the cancer itself is very manageable and the prognosis of it is great.
Phenomenal. Yeah.
However, after the fact is what really, really sucks. And if the cancer doesn't end your life, it's like the stuff that came with it, the depression and the trying to figure that out and not getting the help that you need, not
the
at the time I was and that I was supposed to be better and I looked good. People say, well, you don't look sick. I'm like, well, really? Because I'm dying inside. I didn't want, there was a point where I didn't even want to live. Like, it was so hard to do just everyday stuff. Just menial tasks were really, really hard to do.
Yeah. And when we talk about options, for example, for Graves, which is a hyperactive thyroid, you have different options, and surgery is one. Another one would be thyroid radiation. And I can make a pretty good argument that in some cases, surgery would be better because you're avoiding all of the, radiation, and you're avoiding all of the toxicity that comes with irradiating. Some people might want to have, a partial thyroid, but if that cancer had metastasized to, lymph nodes, I woun't take a chance,
No.
And it is the right decision. Okay, I'm going to tell a story right now, for me. I had wisdom teeth, and I waited too long to pull them. So one of them eroded one of my molars. And the root of it is very eroded. And my dentist says, oh, you're going to need an extraction. It's completely solid, but if you get an infection there, you're going to need surgery. So we preemptively need to take it out. And it's quote unquote a healthy tooth. Well, it sucks. I hate it. I feel sad that they're going to take something away from me that had I been a little bit more proactive with my dental health, I wouldn't have to. Now imagine people telling you over and over, it's just a tooth, dude. You're a guy. No one's going to care. Well, now imagine having everyone that at least is the good cancer. Oh my goodness. I can't even imagine. And kudos to you because sometimes we try to say the nicest thing and the nicest thing is not the right thing to say.
Yeah, and I know that it was, I mean, even all the way down to surgery and, prepping for surgery and I swear I went through like 14 doors to get back to the operating room, and they check your bracelet and your ID and your name and all that good stuff, which you want them to do. But every nurse along the way, it's okay, honey, it's the best cancer to have. And like I said, at the time I was like, okay, sweet, this isn't going to be a big deal. And then the hell started after. It was, treatment was hard. Like the processing of getting prepared for treatment was hard. And then after treatment, when I started my meds, and I was like, oh, this is going to be okay. I'm starting to feel better. But I was just on Synthroid. I was okay for a while, and then it all just went downhill. And then it was just total every day trying to climb out of that same hole every single day. And that's where the hard part starts. So yes, the cancer is easy, quote unquote. And since then, it's funny because when I've been to the doctors for, like acute type of things, and they look at your history, oh, thyroid cancer, do you have your thyroid removed? And I'm like, yeah. And they say, well, it's funny now they're saying that it's not even really cancer. So it's like, well, that's not helpful because I don't have it anymore. So that I don't know why you're telling me this right now, because now I'm going to lose it because I didn't need to go through all this time. But I'm pretty certain with the biopsy and the pathology and
the spread. Yeah. Now, okay, so you've gone through the process of having your thyroid removed, and now it's recovery time. They tell you you're gonna have to be on this little tiny pill possibly for the rest of your life. What then? Can you tell us about your journey through taking Synthroid? We keep dropping that word, and like, what's that? And then we keep talking about T's and numbers, T3 and T4. Can you explain, to us like what T3 and T4 are and what's the difference?
Yeah. So Synthroid is sort of you'd say standard treatment, kind of the go-to for people that show up with a low functioning thyroid. The brand name is Synthroid, and a lot of people are on levothyroxine as the generic. So that's just kind of that little gist. But that's what I was put on initially right after I got done the treatment and that kind of thing. And I did that for 3 years, just Synthroid alone, and would go back to my doctor to discuss my symptoms, check my tumor markers and my TSH, and they wanted it suppressed because of the cancer. And so, we up and down the dosage is what we did with that. And I kept saying, I feel this, and this, all very negative things that I was just really struggling. And it was just like, well, it's just your new normal, get used to it, figure it out. This is just the way it is, or it takes a long time to feel better, all these things. And after third year of that, I'm like, nope, I can't live like this. This is not living. And so I decided to start with a different doctor in a different clinic in a different town, and who I'd heard was a little more open to looking at other things, and including your symptoms, not just your lab work. And so that was bonus for me. And then also looking at potentially trying to see if, adding another medication would help to put that out there. And when I had asked the other doctor about adding, T3, he said with his arms crossed in front of him that, nope, it won't work. This is what we do here. So I was like, okay, that's why I decided to go elsewhere. And that's where I said before that doctor allowed me to try, get a trial of T3, which is the active form. So T4 is kind of considered the inactive thyroid hormone, and it needs to be converted into T3, which is the active form. So I'm thinking, I want active thyroid hormone, not the inactive thyroid hormone, because that inactive thyroid hormone I'm not apparently doing anything with, and I'm feeling very inactive myself. So I needed a way to figure that out. Like I said, that was the thing that sort of allowed me to turn the corner. I hit barriers there too, but it allowed me to get a little bit out of that hole so I could keep going forward.
You could see the light at the end of the tunnel.
Yes, finally.
And and T4 has some activity. Like, for example, the heart doesn't have any T3 receptors. So you do need some T4, and it has, activity. I don't know if you've looked into the research into T2 and how. So this is the way of thinking, okay? Your thyroid only produces T4. Some tissues convert that T4 into T3. Thus, you only need T4 and damn everything else, But there are different genotypes, and there's different people because of malabsorption, because of nutrient deficiencies, because of X. They are not very good at converting that T4 into T3. And that's pretty well documented in the literature, and that's pretty well known. And still, in clinics across the United States, no. I've heard this excuse so many times. Well, different people need different types of dosing. Why would you ever want, in the case of natural desiccated thyroid, something that only comes in 8 standard doses versus something that comes in like 12 standards? Well, if you knew how to dose it properly, you have an infinite amount of dosing capabilities with natural desiccated thyroid. But that's besides the point. And then we don't know. Like, the research is so young when it comes to T2 and the other things, all the other side chain reactions that converting T2 to T3 and the deiodinization and, all of these different things that the thyroid is doing. We know so little, okay? And to think that we know better than our body and you just need Synthroid and shut up, it's insane.
It's maddening. It's maddening. Yeah. And I also think that I don't know, I need some good sources of good publications or something, because I've not been able to find them myself, but I swear that there is something just different for people without a thyroid from surgery. And some people, some people are born without it or whatever, but I feel like there's just a whole different set of rules almost for them, the way our bodies are processing this stuff. It's just not so linear. Take your T4 and your liver will take over and you're good to go. Your thyroid doesn't need to help because your thyroid gland isn't really needed. Your liver will take over and it's all good. And I feel like there's lacking, and maybe you can share some with me. I don't know. I feel like we're lacking literature or research on people without a thyroid and how that acts differently, because I am always lumped into the group of people who have Hashimoto's or have just standard hypothyroidism. And I feel very different than that. And I have heard that very often, time and time again, for other people without a thyroid.
And you did mention something that I want to go, turn around and go back and discuss, but the first thing that I want to say is that your body is not exact. You are going to make more hormone that you need, and you're going to rely on detox. We started with that. We started with how well controlled your body controls thyroid hormone, because the way I describe T4 and T3 is that T4 is like diesel and T3 is like jet fuel. And you need different combinations of diesel to jet fuel in order to accelerate and at the same time not burn out. To think that, someone that uses a dual fuel kind of a thing and providing it with one of the fuels and hoping that your body is 100% efficient in converting that T4 into T3 is maddening. The second thing that I'm going to share with you is there's a paper that basically was like, okay, let's quiet down all these people that say that natural desiccated thyroid is better. So we're gonna test. We're actually gonna test it, and they were looking for the efficacy of a combination of T3, T4, T4 only, or natural desiccated thyroid. Turns out they're equally as efficient at reducing TSH. You can reduce TSH with all three of them. What they didn't expect was that overall well-being was better when, in this case, it was natural desiccated thyroid. So people who had no idea what they were taking, they were just giving a dose. They were like, you know what? And it was a crossover study. So they would start in the synthetic and then they move them to the combination or vice versa. And in the end, it was like, you know what? The levels look well, whatever, but I don't care. I want that other one. I want the one that smells like bacon,
Yeah.
And maybe it's the bacon, flavor. It doesn't actually taste like bacon. But it's because in this case, this is not just a meme where we think, oh, it's natural, thus it's better, because things like arsenic are natural and, it will kill
Right.
you, But in this case, it seems that this natural product works a little bit better. And again, that doesn't mean that everyone should be on this natural product. But what it tells me is that a combination product is going to be much better than a single dose. And I have patients who are very, very sensitive to T3. And if I give them just a little bit of T3, they start having anxiety. They might have a panic attack or whatever. So guess what? They do better with just levothyroxine, And who am I to say no? The research says,
Exactly. Yep.
that's where where the art of medicine kind of takes over, and you look at what's happening, and then you act on that.
Yes, exactly. With the natural desiccated hormone, obviously it's natural, but I mean, it's designed to work with our bodies, and our bodies are so smart and it knows what it needs. And some of the other things, like you said, it doesn't always cooperate as well, but for some people it's perfect. And I feel like just in my world of working with people, I feel like, and it sounds like yours too, that it's more the combination in some way is a better option for a lot of those people. And I think for those people, including myself, we need to obviously look at thyroid function and my numbers and tumor markers and that kind of thing. But what else is going on that should be, what else is out of balance and needs to be addressed so that the thyroid can be optimized a little bit better too?
Okay, before I forget, you mentioned, I went to my doctor and he said your TSH has to be suppressed. Let me speak a little bit about this, okay? Your thyroid stimulating hormone is this hormone in your brain, that in your pituitary that goes and tells the thyroid how to work, how much to work. So TSH actually acts as a growth factor for your thyroid. So your your brain is yelling at your thyroid, hey, dude, make more. And your thyroid really doesn't know what else to do. So it's like, okay, I'm going to grow. And maybe if I'm bigger, I'm going to be able to create more thyroid hormone because this dude is yelling at me that needs more hormone. So it starts to grow, and then there can be one mutation, and that mutation can turn into the best of cancers, thyroid cancer.
Yes. The best
okay,
one.
Yeah, the best one. It's so nice. I wish I had it. And the problem is that if you don't suppress the TSH and the surgeon missed one cell, then you are sending that growth factor to the thyroid, and that thyroid is like, oh my goodness, you're telling me to grow, and it starts growing again, and that's when you can go out of remission. So that's why if you've had thyroid cancer, you should have a good discussion with your doctor about, is it proper for me in my case to have suppression of your TSH?
And what I have understood from that, and that it's been certainly the case, in my situation, is that suppression has been the name of the game for 12 years now. So I'm at 0.08. That's where they like to keep me at, is 0.08.
The latest review that I've read was that it's going out of favor again. And this is a discussion that you have to have with your doctor, because different people have different needs, But, being suppressed does come with some problems. Anxiety, it could predispose you to muscle loss, bone loss, things like that. But if you have an awesome doctor that's on top of those things can also be ameliorated, So this is not an easy conversation or decision that you should make over an hour podcast. This is something that you should educate yourself and definitely talk to your doctor about it. Now, tell me about we talked a little bit about testing. What about antibodies?
So I'm not a doctor, it's very hard for me when I have people come to do their nutrition work with me, and they'll bring in their lab reports and they have their thyroid report with them. And sometimes I've seen a history where it looks back maybe 3 years, and they'll have thyroid antibodies elevated like through the roof. The recent one, TPO, was greater than 1,000. Well, the cutoff in this range was like, I don't know if it was 9 or something like that. So I asked her, have you been diagnosed with any thyroid condition? Because she's on a low dose Synthroid. And I said, so what is your thyroid diagnosis? And she said, I don't know. They just said that I'd probably feel better if I took some Synthroid. So I said, okay. And then we're doing nutrient testing and looking at deficiencies, and that's my wheelhouse. And so I'm just working with her with trying to tamp down inflammation, and then telling her to go back to a doctor or find a different one that might deal with some, with these numbers. Because I've seen this again in my world, which is fairly small as far as patients with that kind of lab result. I see it a lot where their thyroid antibodies are through the roof. I've seen some that are in, 80 to 100, but then I've seen, 300, 500, and then this over 1,000. And it's not been addressed at all. They say that they're fine. Just come back a year to do a med check. That's it.
Yeah. And it's so sad. It's so sad that we even have cutoffs.
Yes.
Have we become so, I don't know, just like roll over and, have we become so complacent that having an autoimmune attack on a gland has to reach a certain threshold before we do something about it? And what I tell my patients is, okay, imagine you have a castle and you're inside your little castle, and then you see 9 archers come in and you're like, there's 9. We're not doing anything. We gotta wait until we get 10. And once you get the 10th archers, like, artillery,
watch out.
Yeah, watch out. No, if you are having an autoimmune attack on one of your glands, why would you wait to start making changes until you hit a certain threshold? And maybe your thyroid, your TSH falls within a good range. Maybe you're like a 1.8, which is, it's still outside of what we denominate as optimal. Maybe your antibodies, the cutoff is 34 for the TPO antibodies, maybe you're at 20, Well, maybe you can start eliminating inflammatory foods. Maybe you can start supplementing with some selenium. Maybe you start avoiding excess iodine. Maybe you will be able to avoid going and taking a thyroid hormone. And wouldn't that be amazing? But what we see over and over is people that have had this attack for so long. And this attack has created nodules. And these nodules are making either your thyroid hyperactive or underactive. And by the time you're coming and looking for answers, and you wish that you didn't have to take that little tiny pill, it's a little bit too late. So, that screening could be so life-changing if you get it early.
Yeah, it could be so huge if it were acknowledged and addressed. And then, I just have to do my best and guide them to refer them on to an endocrinologist or someone who will maybe look differently at their thyroid panel. But the other thing I've heard too, and maybe you hear this, or maybe you don't because you deal with it, but I've heard many people say that they've been told that, it looks like you have Hashimoto's, but it's really not. It's just a fancy name for hypothyroidism. I've heard that too, more than once. And I guess you could say it is. It just acts a little differently. And I don't know, just sort of, I guess it's just the complacency of it. It's just sort of like, that's nothing. Just take your Synthroid and come back in a year.
Let's reframe that then, So instead of saying that Hashimoto's is just a fancy name for hypothyroidism, because what you have is hypothyroidism because they took away your thyroid. Your thyroid can, you have but you don't have Hashimoto's. Let's reframe that and let's say that Hashimoto's is a fancy way of saying autoimmune thyroid disease. And now we have two things that we can identify. That your immune system is confused And maybe we need to decrease inflammation, increase nutrition, and clean our house and detoxify our environment and have less stress because your immune system is attacking you, rather than, oh, your thyroid is just not producing because X, because it didn't form, because no, Hashimoto's is it's a fancy way of saying autoimmune thyroid disease. And if you phrase it in that way, and if you reframe it in that way, now you're empowering people. You're giving the patient control of their health, not just go to your doctor and have that little pill and then go back in 6 months to get retested to see if those levels are fine. Now you can go online and say, how can I prevent autoimmune disease? How can I correct autoimmune disease? How can I help my thyroid work better? And I think empowering the patient is just so much more important than just dismissing an actual condition.
Right. And that's what I try to help the people I work with to empower themselves to realize that when they have a diagnosis of something, doesn't have to be thyroid disease. It could be anything. But what I feel like happens so often is, and this is just coming from what people tell me, is that I have X condition and they said that this is how I will feel. This is how I will go. This will last for 10 years or, whatever. They just have this kind of set of rules that goes with their outcome. And people just go, okay, that's what my life is. I was kind of told that in various ways. And I just don't believe that to be true most of the time. If we're open to looking deeper and looking at all the, like you were talking about, the toxins around the home and the stress and looking at all those things. And if those aren't addressed, we probably will go on that more negative path. But anyway, it's just the whole thing about empowering yourself and advocating for yourself and realize that you don't have to go a certain way just because all of a sudden you turned like 40 or 50 or 60 and all of a sudden you're supposed to fall apart. Yeah. That's
or 24.
That's kind of, or 24. Yeah. I mean, that's where it's sort of, I hear that all the time. Like, well, I have some pain in my knee, but I suppose it's my age. And I look at their age and they're 40. And I'm like, yeah, you're not supposed to feel like all decrepit just because you turn a certain age. Things change for sure as we age in different ways, but we shouldn't just fall apart.
So, as a clinician and talking to someone that has gone through this and your experience is just so powerful. As a prescriber, as a clinician, I have my point of view, and it's very different than someone that like you who has experienced this. What resources are there for my patients where I can guide them and give them the other side of the coin, the survivor side, the thriving side? Are there any publications or anything where I can tell my patient, you need to read this book?
I found it was very hard to find some of these things that were available to get the side of the person really going through it themselves. And so what I wanted to do because of that is write a book. And I finally have done that. It's called The Rock Bottom Thyroid Treatment. And what it does is it gives you kind of an 8-week plan, simple takeaways that you can start doing now to get little wins, to keep you motivated, to see that you can start to feel better by doing certain things that are not that difficult, but it's a learning curve because you may not have done them before. Because people with a thyroid condition, and when it comes to nutrition, usually the focus is on, I need to exercise more, I need to eat less calories, because most of us are trying to get back to a normal weight, or we're supposed to, we're trying to get more energy. And so we go to calorie restriction and then burning ourselves out at the gym. And so this plan is more therapeutic, and it's about, getting to sort of root cause nutrition. I can't obviously get real deep into looking at each individual's nutrient deficiencies in the book, but I go through the process of dealing with, some depression and some food sensitivities. But the bottom line is that you can start feeling better in really short order, no matter how long you've been dealing with your condition, if you know what to do.
And that is just such an amazing tool, because it comes from a person that has gone through it, and that is just so important. What can you tell our listeners, what tidbit, like, for example, any silver bullets that you have to reduce thyroid antibodies. I know a lot of patients that are having trouble with thyroid antibodies. So what would be your number one recommendation?
Number one thing for thyroid antibodies, and it just seems like, oh, here's another person saying to do this. But we need to get the inflammation down. And for thyroid patients, the number one thing to do food-wise is to cut the gluten out. That's I know that's kind of seems like it doesn't matter anymore because everybody says it, but it actually is a huge factor in antibody production. There's other things too, but that's one of the easiest things that person can do. And to be honest, there's other things that are much more difficult for people.
Like what?
Dairy. Dairy is a big
You think dairy is harder than gluten?
From what people's responses, they said, I thought gluten was hard, and then I started being dairy free, and that's the worst. So people really cling on to that.
I've been gluten free, since like 2008. So it's like second nature to me.
Yeah.
I guess I still eat dairy every once in a while. I break out like a banshee. I know it's causing inflammation, but I still do it because it doesn't hurt me. Like, it doesn't make me want to poop my pants. And
some people it does.
Yeah, exactly. So I can see that. Yeah, I can totally see that now.
Yeah. So it's one of those things where I think that's where comes into there's a little bit of a food addiction there. People white knuckle it through the dairy free part of my programs. And, it's all about empowering. I don't know if it's just because I used to be a teacher. I guess I still am a teacher. It's that whole metacognition of what you don't know. And so we pull some of these things out, at least temporarily, so that people can actually connect the dots and learn why they're feeling the way they're feeling. And then obviously the goal is to heal. I mean, deal with gut healing and that type of thing. And once they start to feel the difference, they're like, it doesn't bother them to stay away from the gluten or stay away from, whatever inflammatory food it is that's causing their issues, because they've learned now and they know the consequences. Like you said, you might have it once in a while and you'll break out, what it's coming from. Whereas I've had other people that will, like, I'm going to have that piece of cheesecake out for so-and-so's birthday, and they do it and they know what's going to happen, but then they know what they have to do to kind of heal back from that and recover from it. And so, but they didn't know that before. They didn't know that that's what was causing that to happen every single day. And so it's being very mindful and learning, and that process is going to be different for you. It's going to be different for me. It's going to be different for everybody that's going through the process of trying to heal and to tamp down inflammation. But that would be the number one thing to start with someone with Hashimoto's.
What I tell my patients is that dairy, I know I need to avoid it. Dairy is this liquid that makes tiny mammals into big mammals.
Yes.
In some cases, like cows, tiny calves into big cows or bulls, and in order to grow, you need inflammation. You need to inflame things in order to create insulin spikes and to create all of these cool things. And yes, and we're drinking this very inflammatory thing that happens to taste really delicious when you ferment it or when you do all these different things. Low dose naltrexone. What's your opinion?
Oh, well, I have tried that as well. And I didn't really have an autoimmune process in my situation. I don't know that it really helped me, but I have seen that people have decreased their antibodies substantially with LDN.
In my clinical experience, it's like it either works and is the greatest thing ever, or it doesn't, and the only way to find out is to try it. But I've seen miraculous things happen with low dose naltrexone, and I said people that just getting some weird dreams and that's about it.
Yeah.
Yeah. So it really depends. We're running a little long, and I want to be respectful of your time. So where can people find you? How can people get a hold of you? Where can they buy the book?
Yeah, so the book will be available July 16th, anywhere books are bought. You can get it anywhere. It's called The Rock Bottom Thyroid Treatment, and people can find me at rockbottomwellness.com. And I have a Facebook group called Nutrition for Thyroid Health as well. So if people want to get in and just see what we're talking about in there and get some support, on a regular basis with food and nutrient questions and recipes and that type of thing, that's the place to join there too.
Awesome. Yeah, we'll have all those links on the podcast site. Thank you for coming in and talking to me, and I hope you help us as bunch of people with your new book.
Yeah, thank you so much for having me. I appreciate it. It was a really fun talk.
No problem. I'll talk to you soon.